7 signs that predict how long you will live after 70 in the U.S. older adults. When it comes to longevity, especially life after 70, many Americans wonder whether they will have healthy, independent, and meaningful years. In modern American society, where the average life expectancy has increased significantly over the past century, the question is not only how long will you live, but also how will you live in your later years. This article will analyze in depth 7 important signs that can predict the ability to live a long and healthy life after 70 based on scientific research, statistical data, and insights from leading medical experts in the U.S. We will explore not only biological factors, but also social, psychological, and behavioral aspects that affect longevity. Understanding these signs not only helps us predict, but also provides opportunities to change and improve the quality of life as we age. Regardless of age, this information is valuable to help us make smarter choices about our health now and in the future. The aging U.S. population. Demographic trends. The United States is undergoing an unprecedented demographic shift. According to data from the U.S. Census Bureau, by 2024, there will be approximately 58 million Americans over the age of 65, accounting for nearly 17% of the total population. That number is expected to increase to 80 million by 2040, when the entire baby boomer generation enters old age. In particular, the group of people over 85, known as old in demographic research, is growing the fastest. From 6.7 million in 2020, this number is expected to reach 14.4 million by 2040. This growth poses enormous challenges to the healthcare system, Social Security, and traditional family structures in the United States. Life expectancy and the life expectancy gap. Although life expectancy in the United States has increased significantly over the past century, from about 47 years in 1900 to 79 years in 2024, the trend is not uniform across population groups. Disparities in life expectancy across socioeconomic groups, races, and geographic regions persist and are even growing. According to research from Harvard University and the Rand Corporation, the gap in life expectancy between the richest 1% and the poorest 1% in the United States is about 15 years for men and 10 years for women. These disparities reflect the profound impact of socioeconomic factors on health and longevity. The challenges of aging in America. Older Americans face many unique challenges, including high healthcare costs. According to the Centers for Disease Control and Prevention, CDC, the average healthcare cost for a person over age 65 is 3 times that of a younger person. Loneliness and social isolation. About 28% of Americans over age 65 live alone, with higher rates among women and those over age 85. Chronic disease burden. More than 80% of Americans over age 65 have at least one chronic condition, and 68% have 2 or more. Ageism. Ageism remains widespread in the workplace, the healthcare system, and other areas of American society. Financial security. About 40% of retired Americans rely almost entirely on Social Security as their primary source of income, with the average benefit being only about $1,800 per month. Understanding the predictors of longevity after age 70 is important not only for individuals but also for public policy and national health care planning. Sign 1. Mobility and muscle strength. The importance of muscle strength to longevity. Muscle strength and mobility are among the strongest predictors of longevity and quality of life in older adults. Research from the University of Michigan followed more than 8,000 Americans over age 65 for 10 years and found that those with good grip strength, a measure of overall muscle strength, had a 50% lower mortality rate than those with poor grip strength, even after adjusting for other factors such as age, sex, and health status. Sarcopenia, the age-related loss of muscle mass and function, affects about 10% of people over age 60 and up to 50% of people over age 80 in the United States. It's not just a strength issue, it's directly related to the ability to perform daily activities, maintain independence, and prevent falls, the leading cause of injury and death among older Americans. Activity indicators predicting longevity. Walking speed, dubbed the 6th vital sign in geriatric medicine, walking speed is a strong predictor of longevity. Research from the University of Pittsburgh found that people over 65 who walked at a pace faster than 0.8 meters per second, about 1.8 miles per hour, had a significantly longer average life expectancy. Specifically, those who walked at a speed of 1 meter per second had an 84% 10-year survival rate compared to just 34% for those who walked at a speed of 0.6 meters per second. Ability to rise from a chair. The sit-to-stand test measures a person's ability to rise from a chair without assistance. Research from the University of Sydney, Australia, involving many Asian Americans, found that people who could not complete 5 consecutive sit-to-stands were 3 times more likely to die within 5 years. Grip strength. This is a simple but effective measure of overall muscle strength. A 25-year study from the University of Texas found that for every 5 kilograms decrease in grip strength, the risk of premature death increased by 16%. Ability to balance on one leg. A study from the Kyoto University Medical Center, involving many Japanese Americans, found that people over 70 who could not stand on one leg for at least 20 seconds were twice as likely to die within 7 years. Biological mechanisms and causes. The link between muscle strength and longevity has several biological mechanisms. Glucose metabolism. Muscle is the main glucose metabolizing tissue in the body. Strong muscles help maintain insulin sensitivity and prevent type 2 diabetes, a major risk factor for cardiovascular disease. Immune function. Muscle mass is associated with better immune function. People with more muscle are often better able to resist disease and recover from injury. Nutrient storage. Muscle acts as a protein bank that provides essential amino acids during times of stress or illness. Bone quality. Muscle activity stimulates bone formation, helping to prevent osteoporosis and related fractures. Differences among population groups and cultural factors in the United States. In the United States, there are significant differences in mobility and muscle strength among population groups. Racial and ethnic differences. African Americans and Native Americans tend to have higher rates of mobility disabilities than non-Hispanic whites, largely due to disparities in access to health care, income, and education. Gender differences. Older American women are at greater risk of declining mobility than men, in part due to lower muscle mass initially and more rapid decline after menopause. Geographic differences. Older adults in rural areas of the United States tend to have poorer mobility than those in urban areas due to limited access to fitness facilities, guided exercise programs, and rehabilitation services. Cultural factors. Cultural attitudes toward aging and physical activity influence older adults' activity levels. For example, in Asian American communities, Tai Chi is a popular activity that helps maintain mobility in old age, while Latino communities tend to participate in group physical activities such as social dancing. Impact and improvement strategies. Research shows that it is never too late to improve muscle strength and mobility. Resistance training. Resistance training 2 to 3 times a week can slow or even reverse age-related muscle loss. A study from Tufts University found that people over 90 can still increase muscle strength by up to 200% after 8 weeks of training. Regular physical activity. Walking 30 minutes a day can reduce the risk of mobility disability in old age by 40%. Proper nutrition. Adequate protein intake, 1.0-1.2 g/kg body weight, is especially important for older adults to maintain and build muscle. Fall prevention. Comprehensive fall prevention programs that combine balance training, home environment modifications, and medication reviews can reduce the risk of falls in older adults by up to 30%. For Americans over 70, staying mobile is key not only to living longer, but also to living independently and having a better quality of life. Programs like Silver Sneakers, offered through many Medicare programs, have helped millions of older Americans access age-appropriate exercise programs, leading to improved health and lower healthcare costs. Sign 2. Cognitive function and brain health. The importance of cognitive health for longevity. Cognitive health is a key determinant not only of quality of life but also of life expectancy after age 70. Research from the Rush Alzheimer's Disease Center in Chicago followed more than 10,000 older Americans for 24 years and found that cognitive impairment increased the risk of death by up to 80%, even when controlling for factors such as age, sex, and physical health status. Cognitive impairment reduces life expectancy not only through direct mechanisms such as neurodegenerative disease, but also indirectly through impairing the ability to adhere to complex treatment regimens, make smart health decisions, and maintain protective social networks. Cognitive indicators predict longevity. Information processing speed. This is one of the first aspects of cognition to decline with age and is a strong predictor of longevity. Research from Duke University found that slower information processing speed at age 70 predicted a higher risk of death over the next 13 years, independent of other risk factors. Executive function includes the ability to plan, organize, and multitask. A long-term study from the Mayo Clinic found that people over 70 with low executive function scores were twice as likely to die within 5 years as those with high scores. Autobiographical memory, the ability to recall events and details from one's personal life. Research from the University of California, Berkeley found that declines in autobiographical memory often appear before other forms of cognitive decline and are associated with a shorter lifespan. Language and vocabulary fluency, the ability to use and understand complex language. The famous nun study, which followed 678 Catholic nuns for more than 20 years, found that the complexity of language and writing from youth predicted both cognition and longevity in old age. Spatial cognition, the ability to understand and interpret three-dimensional space. Impairments in this area can predict a higher risk of falls, a leading cause of death among older Americans. Alzheimer's disease and dementia in the United States. Alzheimer's disease and other forms of dementia represent a major threat to the longevity and quality of life of older Americans. Prevalence, about 6.5 million Americans over age 65 are living with Alzheimer's disease, a number that is expected to rise to 13.8 million by 2060 without medical breakthroughs. Impact on longevity, Alzheimer's disease shortens the average life expectancy by 4 to 8 years after diagnosis. However, some people survive up to 20 years after diagnosis, highlighting the importance of care and protective factors. Economic burden, the cost of caring for people with Alzheimer's disease in the United States is estimated at $305 billion per year, projected to rise to $1.1 trillion by 2050. Racial and ethnic disparities, African Americans are twice as likely to develop Alzheimer's disease and Hispanic Americans are 1.5 times more likely than non-Hispanic whites. These disparities reflect long-standing inequities in healthcare and lifetime risk factors. Late detection, more than 50% of Americans with dementia are not formally diagnosed, missing opportunities for early intervention and care planning. Cognitive reserve and brain resilience. The concept of cognitive reserve explains why some people can withstand significant brain damage without showing clinical symptoms. Cognitive reserve refers to the brain's ability to withstand disease without showing clinical symptoms. People with higher cognitive reserve can tolerate more brain disease, such as amyloid plaques and Alzheimer's disease, before symptoms appear. Factors that influence cognitive reserve. Education, each additional year of education is associated with a 7% reduction in dementia risk. Complex occupations, occupations that require complex thinking, decision-making, and human interaction are associated with a reduced risk of dementia and longer life expectancy. Lifelong intellectual habits, mentally stimulating activities such as reading, learning a new language, playing a musical instrument, and solving puzzles continually build cognitive reserve. Social interactions, a large and meaningful social network plays a key role in maintaining cognitive function and longevity. Neuroplasticity, the brain maintains its ability to adapt and reorganize through new neural connections even in old age. Research from the National Institute on Aging shows that people over 80 can still form new neural connections through learning and exercise. Strategies for maintaining brain health. Research from leading organizations such as the National Institute on Aging and the Alzheimer's Association has identified several strategies that can help maintain brain and cognitive health in old age. Physical activity, regular exercise increases blood flow to the brain, stimulates the production of brain-derived neurotrophic factor, BDNF, and reduces inflammation. A study from the University of Illinois found that walking for 40 minutes 3 times a week increased the volume of the hippocampus, the brain's memory center, by 2% after 1 year. Mediterranean-intervention for neurodegenerative delay, MIND, diet, combining elements of the Mediterranean and diets. The MIND diet emphasizes dark leafy grains, berries, nuts, olive oil, fish, and poultry. Research from Rush University Medical Center shows that strict adherence to the MIND diet can lead to significant health benefits. Ability to rise from a chair. Ability to rise from a chair without using hands reflects muscle strength and balance. The sit-rise test, older adults are asked to stand up and sit back down in a chair 5 times in a row, is a strong predictor. People who complete the test in under 12 seconds tend to live longer. People who cannot rise without using their hands are 2 to 3 times more likely to die in the next 5 years. Social networks. Social relationships play a key role in longevity. Older adults with at least 5 strong social relationships are 50% more likely to survive after 5 years. Loneliness increases the risk of death in older adults by up to 45%. People who regularly participate in social activities, church, clubs, volunteering, live 2 to 5 years longer than those who are socially isolated. Cognitive ability. Brain health strong link to longevity. People who maintain good cognitive abilities, memory, processing speed, executive function, tend to live longer. Mild cognitive impairment increases the risk of death by 80% within 5 years. People who regularly engage in mentally stimulating activities, reading, playing a musical instrument, learning a new language, are likely to live 2 to 3 years longer. Nutrition habits. Diet plays an important role in longevity. Adhering to a Mediterranean diet, high in fruits and vegetables, olive oil, fish, low in red meat, is associated with a 30% lower risk of death in older adults. Consuming more than 5 servings of fruits and vegetables per day is associated with a 3 to 4 year increase in life expectancy. Limiting sodium, refined sugars, and processed foods reduces the risk of death from cardiovascular disease and diabetes. Regular physical activity. Regular exercise is an important factor in determining longevity. 150 minutes moderate physical activity each week reduces the risk of death by 22% in people over 70. Even walking for 30 minutes a day reduces the risk of premature death by 20%. Strength training twice a week reduces the risk of premature death by 46% in older adults. Positive attitudes about aging. Psychology and attitudes toward aging significantly influence longevity. Research from Yale University shows that people with positive attitudes about aging live an average of 7.5 years longer. People with a clear sense of purpose in life have a 40% lower risk of death. Resilience to stress and crises is a strong indicator of longer life. These signs are not only predictive tools but also valuable guides to improving the quality of life in the years after age 70. The good news is that most of these factors can be improved. Importantly, these markers do not work in isolation but rather have a synergistic effect. Improvements in one area often lead to improvements in others, creating a virtuous cycle of better health and longer life. In the United States, where life expectancy is increasing and the population is aging rapidly, understanding and applying this knowledge benefits not only individuals but also society as a whole. Public health programs that focus on these factors can help reduce long-term healthcare costs and improve quality of life for older adults. Finally, it is important to remember that it is never too late to start improving these factors. Studies have shown that even small changes in your 80s or 90s can have a significant impact on both longevity and quality of life. Aging healthy, living a happy, productive life is the goal everyone should strive for.